final one that I'm going to be looking at here is the intervention studies, which includes randomized controlled studies or trials. And often here we're starting with a baseline cross-sectional study of the population at risk, all of those who are going to be eligible for the interventional trial, whether it's geographically based or whether it's based in a hospital or whether it's based in another school or workplace or something like that. So the objective here is to identify those who are eligible and those who are free of the disease so that we can then look at that. It might be that we're looking at those who are free of the disease and we're looking at incidence of disease. It might be that we're looking at people who are have the disease and we're going to have treatment or an intervention which is going to be given to those people with the disease, in which case we are going to have people who have the disease as our eligible. The key thing about randomized controlled trials and cluster randomized trials is that there is a randomization, that individuals don't know whether they're going to receive the intervention or not. There is a way, an allocation of that, which is completely at chance. It's not my responsibility. It's not the choice of anybody in the study to give that person the intervention or not. That is determined by chance through a spin of a coin, through the numbers in a pre-sequence that we have. And those people then, some of them receive the intervention and some of them are not. And the reason for the randomization is that then we have two groups of people who are utterly comparable. You have the same proportion of people who are males and the same proportion who are females, the same proportion who are old, the same proportion who are young, and the same proportion in both groups for all of those other characteristics. When we then follow them up over time, the objective then is to measure the outcome after a period of time and say, if there's a difference in the outcome between the group who received the intervention and the group who didn't receive the intervention, then that difference is due to the effect of the intervention that we gave them. There is a question here about what about follow-up, and there's a big question that rises every time a trial is conducted, is that if there's a lot of people who are lost to follow-up, we could be missing out and we could be biasing our responses by that. However, intervention studies, randomized controls, gold standard assessment. They are the ones which are used by governments, and regulatory authorities, and clinical companies, pharmaceutical companies, to say this drug, this vaccine intervention is good for this particular disease. So they are the gold standard for the effect modification, for the effect assessment, but they may not be fully representative of the whole population, because often randomized controlled trials, they say the eligible people have a particular set of characteristics, and anybody who doesn't have those characteristics may not be part of that trial. And we don't really know what happens in those who are not chosen for the trial. So there is some questions there about intervention trials, randomized controlled trials, as to whether they're representative of the whole population. Okay, I'm going to have a look and see whether there's any more questions here. But in the meantime, I'm going to ask you, study designs would you use? You remember those five research questions or questions that you had in task one? What study designs would you use to study these outcomes? I'm just going to have a look at the chat and the questions. Okay, most of the questions are for Diana to get something from the sites. Yeah. So, someone's asked an interesting question about snowball. Now, snowball sampling is often used in qualitative research. So snowball sampling is something which whereby one person is asked some questions and given some responses, and then they're asked to refer other people into to be asked the same questions. And that's very useful for qualitative research. I'm not a qualitative researcher, and epidemiological designs are much more based upon randomization and chance. And so snowball sampling is not something which we would use in an epidemiological study. Okay. Okay. Yes. So someone's then asked me for a case control study, an example of a case control study for the risk factors for lung cancer in a population next to a paint factory, for instance. Lung cancer, and other conditions are quite rare. And so what we would do is we'd set up a cancer tree in the hospitals so that we could detect anyone who comes into the hospital. And of course, people might come into the hospital and be identified with lung cancer, and we get cases of lung cancer, and we would have lots of people there. And some people might not still live next to the paint factory, but they may have done in the past. And so we'd ask them a set of questions about, where they lived, whether they worked in this paint factory, whether they lived close by, whether they drank water from the wells which were close by to this paint factory, etc., etc. And of course, all of those questions would be very useful. But unless we have our controls, we wouldn't know whether those were risk factors for the lung cancer or whether they were just things which happened to everybody in that particular area. And so we recruit our controls from people who don't have lung cancer, and we could recruit them from people who are attending other services in the hospital. We could, so the one thing is we could have controls which are selected based upon their attendance in the same hospitals, and that would be one form of controls. We might also choose controls who are living next door to our lung cancer patients, and so therefore we would be able to say, yes, we could choose them. They're going to be very similar to the cancer patients in where they lived, and we would then ask them whether they came from the hospital or from the workplace or from the residents, close by residents. We could ask them the same set of questions that we'd ask for the lung cancer patients. Have they lived in this area? Did they work in that paint factory? Did they get any services like water from the wells? The difference between the responses from the cases and the responses from the controls would give us an odds ratio for the factors in terms of their association with the lung cancer that we are observing. So that's an example I give. I don't know whether that's useful to you, but let's have a look at what is here. Cross-sectional studies, prevalence of depression. Yes, cross-sectional studies will be able to give us an idea of the prevalence of depression. And because they are all located in one point in time, that would be quite useful. Cohort studies measure incidence. Yes. Okay. Who's this? Someone wants to unmute. Okay. Okay, I think I've got most of those there. Ecological studies. Ecological studies is where we have data from groups, but we don't have data from the individuals within the groups. And we might have that data if you're looking at the HMIS data from hospitals and from health facilities. We might have each of our hospitals. We can't tell anything about the individuals there, but we might be able to say that in this hospital there were 25 cases of depression who were in the last month. In this health center, 5 cases were treated in the last month, and we can relate the numbers there to the services which are available in those health facilities. So an ecological study might be able to tell us something about the facilities which are serving those particular people. Okay, anyone have any other questions there? Case control study for the depression, cohort study for the incidence of anxiety. Yeah, ecological impact on climate change is good. Yeah. Okay. I'm going to, unless there's any other questions I can see here. Oh, is there a couple of attendees who've got their hands up? Let's have a look. Yes. Who's this? Dr. Yinka, do you want to allow you to talk? And do you want to ask your question? And Faith, I'll allow you to talk as well.
Good afternoon.
Good afternoon. Yes.
Okay, you can hear me. Thank you.
Yes.
Thank you, Jim. Thank you for this lecture. Very enlightening. I just want to understand the relevance of effect size, and
Effect size, yeah.
and randomized control or intervention study. And that is number one. Number two, I want to know the difference between odds and odds ratio.
Okay, good. Okay, so thank you very much. Good question. So effect size is really, I mean, before you start a study, you should be able to say, what is the size of the effect that I want to look at? You know, are you looking at a big effect or a small effect? And of course, it would be important, biologically important, clinically important, to look at an odds ratio of 2, let's say twice as many people, or odds of being treated successfully with a particular drug is twice as big in one group as it is in the other group. And so, you know, we're looking at effects usually, and in an intervention trial, then we're usually looking at quite big effects. Does this vaccine prevent 50% of the cases of meningitis or 50% of the cases of COVID-19 or whatever it is? Does, you know, we're looking at big effect sizes. And the big effect sizes really determine the sample size of our intervention. And so the intervention is powered to detect a particular effect size. So the effect size is going to be important in designing, in calculating our sample size. Sorry, some people are asking for a body break as well. Maybe after this, we can just have a 5-minute break. Right. The thing you asked, Yinka, was about odds and odds ratios. Now, if you've got one group and you're looking at the odds, if I go back to, yes, okay. In fact, I think it's in the next part of my group, and you're looking at odds of depression in the males is going to be the number with depression divided by the number without depression. And so that's going to give us the odds in one group. If we're going to compare two groups, then we're going to look at the odds ratio. The odds in one group divided by the odds in another group. And so that's going to give us an odds ratio. Okay, so odds ratio is about comparison of two groups. Odds is the thing that you would calculate in one group only. Okay, so I think we're going to have a short break here of 5 minutes. I'm aware that I've got a couple of hands up here. I've got Faith, I've got Abdi Karim, and I've got Odette. So when we come back, is that okay if you ask your questions after we have a short break, or should I have a short break? Should we have a short break now? Is that okay? Okay, I'm going to just mute and stop the video for 4 minutes. Is that okay? Talk. Dr. Abdi Karim as well, if you're there.
Hello. Hello.
Yes, hello.
Can you hear me?
Yes.
Still, I have a problem for the effective size. I am not get your point. You are divided into two parts: big size and small size. You says if the sample is greater than 50%, it is big size. Mostly it is calculating for the sample size. But for the small size and big size, still I need to for the clarification.
Yes. Okay. So say you're looking at depression, and you say the prevalence of depression in one group of people is 5%. Oh no, let's say 5. Yeah, it's 5%. That's good. If it's 5%. Now you want to compare the group of people who have a prevalence of 5% with another group of people who have a prevalence of 10%. So that's twice, that the prevalence is twice as much in one group as it is in the other group. And of course, if you do that, you can calculate your sample size, and you might come up with a sample size of needing, let's say, 200 or 300 people in each of your groups, in order to be able to calculate, or in order to be able to show that result as significant. And that's quite a large effect. Twice as many people have depression in one group as they have in the other group. If you say, they have 5% in one group, I want to find out about people who have 6%. I want to look at an effect size which is very small, which is only a 1% difference. Instead of needing 200 or 300 people in each group, if you're looking at a big sample size of 5% against 10%, to look at the difference between 5% and 6%, you're going to need thousands of people in each group. You maybe need 3,000 or 4,000 people in each group, simply because looking at a very small sample size, a very small effect, means you need a large sample size. And of course, the difference between 5% and 6% might be, you might think it's important, but actually clinically is less important. That difference between 5 and 10% might be quite clinically important. Between 5 and 6% might be saying, oh, there's not a lot we can do there. We can't put all of these resources in reducing our prevalence of depression or treating people with depression with such a small effect there. And so having a large sample size is a problem. It takes a lot more resources, and you're going to be trying to find a very small effect size, which is not necessarily clinically important. Having a smaller sample size, but looking at a bigger effect is going to be more important in the long run. Okay. Thank you for the question, Dr. Abdi. Okay. Odeta, let's have a look and see if I can allow Odette to ask a question.
Okay, thank you. Can you hear me?
Yes.
Okay, so my question is with respect to the effect size. So I was doing an intervention study on post-traumatic stress disorder. So I couldn't find, like in literature, an effect size that has worked based on my intervention. So it was really kind of tricky to get the effect size so as to calculate the sample size for the intervention study.
Yes, that's often the case, and often you can't find there's no published literature which says this is the effect size you should be looking at. But of course, an effect size is something that you're going to, as the PI of the study, you're going to say, I think that this is important. Something that you will define as important for your study, and say that if you had this big, an effect size this big, then this would be important to you, be important to the research community to show that this particular intervention will help with post-traumatic stress in this particular condition or something like that. And so you're determining what that effect size might be, but that effect size will then affect or will determine the sample size that you have for your study. Okay. Okay. So Reagan has got a list of questions here. Okay, that's mostly the answers to the questions I had there. Yes. Okay. Yeah. Yes. So you can look these up in some of the books. They will have some plausible ranges for sample size for effect sizes that might be looking at, and they will then lead to particular sample sizes that you want to have there. Thank you for that. Was that Ronald, was it? Yeah. Okay, I'm going to carry on then with the next bit of this, unless there's anybody else there. Oh, Asrat. Final question before we move on.
Yes, please. Can you hear me?
Yes.
So my question will be on research designs. Like there are two types of designs: descriptive and quantitative and qualitative. So if a study, for
Yeah.
example, is studying the prevalence of a disease and the associated factors for that disorder, is this going to be a quantitative or a qualitative study, or is it a mixed one?
I think if you're going to look at the prevalence, then you're going to be collecting measurements of particular things, and so therefore it would be quantitative. I think the quantitative aspect means you're collecting numbers, you're determining what the scores are, what the exposures are through a quantitative number system, whereas qualitative is much more about asking questions, looking at reasons, finding out what people say is how they're feeling and what their causes might be in a descriptive way which uses words rather than numbers. That's how I see it. Qualitative is often about looking for reasons using words, whereas quantitative is often about collecting numbers. Of course, the numbers represent yes and no. The numbers represent the different categories that you might have in your exposures, but it's a quantitative way rather than a qualitative way. So, and there are mixed methods which use both, but I think in some ways they are a combination of both qualitative and the quantitative methods that we have together.
So we should say
Okay.
it's a mixed one.
Sorry?
When we use it. So if we study
Yes.
the prevalence and the associated factors, we should say this is a mixed study.
I would say it's if you're going to look at prevalence of a condition and risk factors for that condition, then it's likely to be a quantitative, statistical methods rather than qualitative methods. Which so I would say those are quantitative methods. I think there's a lot of talk about the difference between the two, but they're both trying to understand what it is causing a particular disease, particular condition.